Hi, I'm Todd Walker, and I've spent my career in front of a camera. So for me, it is of utmost importance that I take care of my skin and my skincare, because let's face it, this is how I make a living. So I like to turn to an expert, a board-certified dermatologist, to find out where I'm at and what I need to do. So I'm with Dr. Jozef Lazar today, and you're going to tell me a little bit about skincare. So first of all, tell me, why is it important seeing a board-certified dermatologist when it comes to skincare, exams, and prevention?
So Todd, many people claim to be experts in the skin, but they don't necessarily have the requisite training to pick up on the subtle nuances of what we deal with every single day. In order to become a board-certified dermatologist, you have to go through 4 years of undergraduate studies, an additional 4 years of medical school, a year of internship, 3 years of dermatology training, and then many of our partners go on to additional fellowship training, including our surgeons who perform Mohs surgery.
That's a lot of training.
Yeah, it is. In fact, if you add that all up, it can be 12,000 to 16,000 hours of patient care alone, simply to sit for the board examination.
And is there a reason that you really need to see a dermatologist outside of just seeing your regular doctor?
Many primary care doctors are also wonderful at doing skin checks, but they're also oftentimes managing many other conditions. They may need to manage high blood pressure and high cholesterol, whereas we have the luxury of solely focusing on your skin, really doing a thorough examination and being completely present, focusing on just that one complaint.
You know, Dr. Lazar, let's talk about that a little bit further, because what about if something is misdiagnosed and you go in and, what are some of the scenarios that, might result in a misdiagnosis?
Yeah, that's another really good point. So one of the things that we deal with the most in dermatology is skin cancer screening. And skin cancers are so prevalent. In fact, in the United States alone, every single day, 8,500 new skin cancer diagnoses are rendered. It's the most common of all cancers in the United States.
Really?
Yeah. Fortunately, in most patients, if caught early, patients have a wonderful recovery and don't have recurrence. On the other hand, if there is delay in diagnosis or treatment, or if inappropriate treatment is rendered, you can have very significant consequences, increased morbidity, and sometimes even death.
Okay, so if you want to go in and see a board-certified dermatologist, is there a long waiting period in order to get in? Because now you have me thinking. So I find something, and it's important to have that checked right away. So how hard is it to get an appointment?
Yeah, so Todd, we're really lucky here at Dermatology Consultants to offer same-day, next-day appointments.
Same day?
Yeah,
wow.
Within a day. We can get you in between one of our 4 offices at Eagan, Vadnais Heights, St. Paul, or Woodbury. We have only MD doctors, only board-certified dermatologists. So while many groups can offer you a skin expert to get you in to see you daily, very few, if any, can offer you a board-certified dermatologist same day or next day in the Twin Cities.
That's pretty amazing. So what about regular visits to a dermatologist? Is this something you should do annually, quarterly? How often should you actually come in for a screening?
Yeah, Todd. So it all kind of depends on your individual risk factors. If you have a fair complexion, a strong family history of skin cancer, if you happen to have had some significant sun exposure in the past, or if you do things like tanning, based off of all those risks, folks can have a different recommended follow-up frequency. On average, that can be once a year to once every couple years. And it's not just skin cancer, it's many other things that we can help with as well, including common conditions like acne, warts, psoriasis. We deal with the serious stuff too, but we want everybody to feel great in their skin, and we're very fortunate to be able to offer that comprehensive skincare expertise here at Dermatology Consultants.
Well, Dr. Lazar, I got to tell you, you've definitely convinced me that if you are going to have your skin checked, you definitely should go see a board-certified dermatologist.